If you have ever wondered what pelvic floor physical therapy actually is, or thought it was only for women with major birth complications, this episode is going to change the way you think about postpartum recovery. Today, I'm joined by pelvic floor physical therapist Genevieve Richter from Method Physical Therapy, and we're talking about why pelvic floor care should be standard for every mom after birth. We will cover what really happens to your body postpartum, how to heal issues like leaking, prolapse, and diastasis recti, and even how physical therapy can help with mastitis. This is the kind of conversation I wish every mom could hear. Enjoy today's show. Feeling exhausted, overwhelmed, and like you've lost yourself in the postpartum chaos, struggling to rebuild your strength, heal your core, and feel confident in your body again? Hey mama, I'm Val, a functional sports dietitian, postpartum fitness coach, and a mama who understands exactly what you're going through. Welcome to the Strong and Nourish Mama podcast, where I help busy moms like you regain your energy, rebuild strength, and feel amazing through simple, science-backed nutrition and fitness strategies. If you're ready to go from depleted to strong, nourished, and unstoppable, you're in the right place. Let's dive in. Hey mama, before we dive in, I want to take a quick second to remind you that enrollment is open for the Strong, Nourish, and Energized Mom Method program. This is an 8-week experience designed to help you rebuild your core and your pelvic floor strength, restore your energy, and feel confident in your body again after baby. If you've been dealing with leaking, core weakness, or just feeling run down, this program walks you step by step through how to heal, fuel, and get stronger without spending hours in the gym or following a strict, rigid diet. You can grab your spot now and the exclusive bonuses at wellnessbyval.com/program. I would love to see you inside. Today is a goodie. It is such a great episode. So I'm going to tell you up front to save it because you're more than likely going to listen to it again. I'm going to listen to it again, and I'm the one who did the interview. And you're probably going to want to share it with all the mamas, all the women, all your friends. It is filled with so much information. I am so excited to welcome Dr. Genevieve Richter, a pelvic floor physical therapist and co-owner of Method Physical Therapy in both Albuquerque and Santa Fe, New Mexico. Now, full disclosure, Genevieve is my pelvic floor physical therapist. I'm not currently going to PT right now, but I consider her mine since I've met with her, and I'm probably going to definitely go to her in the future. I first met with her in 2022 before I got pregnant. I heard her speak. I was learning about pelvic floor physical therapy, and I was like, oh my gosh, this is so cool. I need to check it out. I need to see what this is about. So I met with her before I got pregnant. And then when I got pregnant, I continued meeting with her, especially for birth prep. And then the first year postpartum, I was meeting with her. Maybe I met with her like 4, 5, or 6 times throughout that year, probably closer to 6. And I cannot say enough good things about pelvic floor physical therapy or Genevieve because she's absolutely amazing. I've learned so much from just meeting with her one-on-one and especially having this conversation with her. So let me just dive in and tell you a little bit about her, and then we'll get into the interview. So Genevieve is a military brat who's called New Mexico home for over 25 years. She graduated from the University of New Mexico in 2010 with her doctorate in physical therapy, and while still in school, she discovered her passion for pelvic floor health, a specialty she's been dedicated to ever since. In 2020, she opened Method Physical Therapy with her business partner, Nora Quintal, where they specialize in pelvic floor and orthopedic conditions with a strong emphasis on community education and outreach. Genevieve and her team are passionate about empowering pregnant women with knowledge about how their bodies change during pregnancy and improving birthing strategies and optimizing postpartum recovery. Today, we're talking about so much information. We're going to talk about why pelvic floor therapy should be a standard part of postpartum care for every single woman and how it can help with some of the most common and least talked about challenges after birth. Without further ado, here's Genevieve. If you can share with the audience what pelvic floor physical therapy is, because this is something that I discuss with my clients and friends and family all the time. And I tell them, you have to go see a pelvic floor physical therapist. So can you start by telling us what pelvic floor physical therapy is and how you got into this work?
Sure. Well, and also thanks for being such a good advocate for it. it really, I became a pelvic floor PT because of personal experience. I had pelvic pain for probably 5 years that I would spend so much time at my gynecologist, and they would say, "Oh, it's a yeast infection. It's because you ride a bike. It's, all these things. You're eating this types of food." And I would change it, take medication, and nothing would make it better. And when I was in PT school, we had this small little unit on pelvic health. And basically the teacher comes in and she's like, I don't work in this. I don't really know much about it. It's not a very big field. There's not too many practitioners that do it, but we have to teach you on it. And she literally had like typewriter notes for us. This is how old I am now, right? But typewriter notes, and she would kind of read through it. But as she was reading through these different diagnoses and symptoms, I literally, like, it was like my brain was exploding because I was just checking off the boxes of these symptoms I've had, like painful intercourse, urinary urgency and frequency, like pain when underwear touches my vulva, all these things. And I was like, what is this? And as we went through this short unit, I was like, I I knew I had to like get more experience in this. So I went and changed my last rotation that I was going to do. This was my last year of PT school, and I asked to do a pelvic health rotation. And at the time, there was only maybe, I don't know, two or three practicing pelvic health PTs in New Mexico. And they were all at UNM, University of New Mexico Hospital. And so I did a rotation in it, and it literally was life altering for me. And I was like, this is what I want to do. So I'll jump into what pelvic floor PT is after that is essentially we work with the skeletal and muscular systems that are in the pelvis and the abdomen. And at first, I will say that we are orthopedic PTs. We really should know the whole body because it's all connected, but we specialize in the pelvic anatomy and things that go wrong. So that's more traditionally going to be urinary incontinence, fecal issues like constipation or fecal incontinence, pelvic pain, so inability to have intercourse, or just general pelvic pain, what we call a headache in the pelvis. It just aches all the time. And then, a big part of this is working with pregnant and postpartum women. And so the changes that affect the pelvic floor during pregnancy that maybe cause some of these issues and then persist afterwards. So that's a really large population for us. So anything that can go wrong with like the pee, poop, and sex areas, that is what we work with.
That's awesome. Thanks for explaining
Mhm.
that. And I think
Yeah.
it's great. It's kind of surprising how small the pelvic floor community was, I guess, when you were
Yes.
going through school.
Yeah.
Now, has it grown in New Mexico at least, or in Albuquerque?
Yes, it has grown monumentally, which has been amazing. When I first started, I really kind of felt like actually I was kind of on my own, and I was really dependent on going to, courses, but I felt like I was navigating it myself. And now, our community, I bet there's upwards of at least 20 of us, and we
Wow.
have a really sweet support group for each other. We all know each other really well, and it's been really great. And so I couldn't be happier for our community because I
Mhm.
think that I'm, I again am partial, but I think that everybody at one point in their life, whether you are female or male, there is something that will probably go wrong with your pelvic floor that you want help for. So it's great that it's really gained some momentum in society as a large.
Everyone has a pelvic floor. It's not just I think a lot of the times we see it when women are pregnant and then in the postpartum journey, but obviously everyone has a pelvic floor. So you can go see a pelvic floor physical therapist for other reasons. And
Yeah.
you mentioned headache in the pelvis. I never heard that. That's really
Hmm.
interesting. And other symptoms like what I'm thinking in terms of women's health, like endometriosis,
Yep.
PCOS. Do you see
Got it.
patients for
Yep.
those? Okay. Yeah, because it's all interconnected. And I like
Yeah.
how you also mentioned we're one being. And so, of course, your main focus is the pelvic floor area and the organs, of course, that surround that and the other muscles. But you have to know the entire body because
You do.
if you're sneezing or, I mean, other things are going to work either downstream or upstream.
You
that's going to
got it.
affect the pelvic floor. So that's super interesting.
Exactly. I mean, you could do a whole podcast on the connections of the foot and the pelvic floor. You know, it's
Yes, I remember
yeah.
talking to you about that.
Yeah, it's all connected. So, yeah, it really is. I mean, I can't tell you how many times we're referred patients that have hip pain from like a general orthopedic PT, and they just have tried everything and nothing has made it better. We do a pelvic floor assessment, and it turns out it's the pelvic floor, right? And it's referring to the hip or it's causing some hip issues. So, yeah, it's a pretty amazing field to be a part of.
And when we're talking about the pregnant and postpartum population, why do you believe that it's so important for those women during pregnancy and then especially after having your baby in that postpartum period, your
Mhm.
postpartum forever, but especially maybe that within that first year? Why
Mhm.
do you believe that it is so important for those mamas?
Thanks for giving me privilege or the privilege to talk about this because this is one of my biggest soapboxes, occupational soapboxes and political soapbox. Really, I think that what we know from a science background of how our bodies change during pregnancy, it's kind of insane. It really is insane. I usually tell people it's kind of like taking a grenade and putting it into the middle of our body and exploding it. And then we have this baby and we're expected just to at 6 weeks post, hop back up and get back into life. But the science does not support that, right? Essentially, if we think about the changes that happen in the pelvic floor during pregnancy, I'll just name a few. The pelvic floor itself literally drops 2 inches during the pregnancy process and then has to expand to 6 times its size if you have a vaginal delivery. That's insane, right?
That is
Like,
nuts.
what other muscle group? If I lengthen your bicep, 2 to 6 inches, and I said, now do a bicep curl, I'm going to give you this 20-pound weight and give me a bicep curl, that muscle's not going to work,
No.
right? And it's not working back to normal at 6 weeks. We know that too. And so, that happens to the pelvic floor, the abdomen. I know you guys talk a lot about probably with your clients about diastasis recti. The abdomen has to grow and expand and literally split down the center in 100% of patients by the end of their pregnancy. All right. And so you have all these changes. You have this baby, and you're expected to keep this baby alive and also get back to functioning normal. That's just not how it works. It really takes what the literature says is that it can take 6 months or longer, depending on how many pregnancies you've had, for the uterus to even return to its normal shape and size and location within the pelvic floor. It can take a minimum of 4 to 6 months for the pelvic floor to return, in quotation marks, to a normal length. And really, I see that quite a bit longer if you've had multiple pregnancies. And so it's one of these things that a lot of women are not educated prior that their bodies are going to go through these changes. And then there's a lot of frustration and disappointment in their postpartum phase that they're not fitting into their jeans, or they're not running, or they're having incontinence, or they maybe have this heavy sensation. And I think that we're doing a disservice by not educating people that these are the changes and they're not permanent, but there are a lot of things that we can do to prevent them from sticking around longer than they need to, and to prevent, maybe negative outcomes in the future. So, one of the things that I like to, tell people is that in Europe, where it's mandatory in France to get 6 months of postpartum PT, we look at these longitudinal studies that show that these women have significantly decreased incidence of pelvic organ prolapse, urinary incontinence, pain with intercourse. And it's because they have somebody who are helping them navigate these body changes, to either help them heal or to teach them the correct methods of getting the muscles to re-engage. So I think that like we would probably save money on like a medical aspect on a whole if we had pelvic floor PT be something that was almost mandatory for people. But I think that, people would probably have, women would have a lot more even positive thoughts, feelings, memories on their pregnancy and their postpartum phase as well, if they went in there educated and had some tools to help them heal better.
That's a good point. And I didn't know that about those other countries having like mandatory 6 months with a pelvic floor PT. And that is
Mhm.
amazing. And it would be
Yeah.
totally different because a lot of the times women don't know about a pelvic floor physical therapist. They don't know about the changes, right? So education is key, like you said. And rushing back into everything, like a lot of women that I talk to, some women have to go back to work 2 weeks after having their baby, right? So if that's the case, and then they're not like they're already walking and they're doing all these other activities and taking care of their baby and they're not focused on healing and recovering, it's definitely going to impact them down the road. And you said multiple pregnancies. So if that does that mean like close together or just in that woman's lifetime?
Multiple, just in their lifetime.
Okay.
Yeah, yes. It's really the more pregnancies that you have, the longer that we see it takes the uterus and the pelvic floor muscles to actually return to their, again, in quotation marks, normal resting points. And so it can be challenging. And some women like bounce back really fast and and they're the outliers, honestly. Like the most are going to take a little bit longer. So really what the newer research on like return to running, return to heavy lifting is waiting to closer to about this like 12 to 14 weeks, because that's really coming from a pelvic floor standpoint of the pelvic floor being able to start to accept higher loads, intra-abdominal pressures to prepare for more of those like plyometric or weighted activities. Yeah.
That makes sense. 12 weeks, three
Hmm.
months. I mean, you were pregnant for 9 months. So, like, I think it's kind when you think about it, right? If you were pregnant for 9 months, you have your baby, and then you just expect your body to bounce back, like you said with the grenade, right? Everything's
Yep,
blowing up in front of you, and then you're expected to get back to what you were doing. It's unrealistic thinking.
it
And
is.
so if you just give your body that time, focus on those foundations and going into that postpartum period knowing that. So
You
that's where
got
the
it.
education comes in because a lot of moms don't know that. So they think they have to get back into the running and the exercising super quickly.
Exactly, exactly. And that's what, I think that pelvic floor PTs and other workers like yourself, clinicians like yourself that are working with these populations, if we can change the narrative that we all aren't going to be like the supermodel down the whatever that we're seeing on the news and whatnot, that at 6 weeks are back in their bikini, we're going to do a service for the population as a whole. And it's really important because I just think that, like I said, we're going to prevent a lot of injuries, a lot of incidences of people coming in and like saying, like, I can't tell you how many times I've had someone come in that they said they started running at 6 weeks and all of a sudden they have this heavy bulge sensation in their vagina. And, we do an evaluation and they have pelvic organ prolapse because they just started too soon with muscles that are still pretty much in a state of shock from the delivery process. And so if we could just get these women in, do evaluations, do some education, do some exercise, strengthening type activities, I think we prevent a lot of that.
This is even for women who had an uncomplicated birth, right? Like
Yep.
everything like was perfect and no tearing or anything.
Yep, exactly.
Okay.
Yep. Yeah, because the delivery process to have a vaginal delivery, when you're expanding, growing, like lengthening the pelvic floor, to and it's 6 times its size to stretch to allow that baby's head to go through, it's going to take them a while for those muscles and the tendons to really heal and to come back. And sometimes they actually physically will change length permanently. For example, there's a muscle called a urethral constrictor muscle that is this, it's basically like a piece of tape that adheres the urethra to the back of our pubic bone. Just the act of being pregnant, whether you had a vaginal delivery or a cesarean, it doesn't matter. That muscle will physically widen and lengthen out to the sides. So it has changed shape and it's not going to go back to the way it was before. And that's why we have increased risk of incontinence after having babies, because that muscle is now an entirely new muscle. That doesn't mean we need to have incontinence. It means that we need to strengthen that muscle to adapt to its new shape, right? And the same thing, we find that with the diastasis recti, with the abdominal muscles, our six-pack muscle physically will widen and thin out, and it's not going to be the same muscle you had before. It will never be that same shape as before. And so it is really important that we're now educating that woman on how to use those muscles in a different manner than she was using them prior.
That is so interesting and fascinating that the pelvic floor expands 6 times its size.
Yeah. I mean, imagine the size of that baby, right?
Yeah, that is nuts. That is
Yes.
that is pretty cool though. And I
Yeah.
remember when I was meeting with you after I had my baby girl and you were doing an evaluation, you were telling me, oh, this has shifted, the bladder has shifted, or maybe that muscle, the urethra constrictor shifted.
Mhm.
I was like, whoa, that's weird. And you're like, no, it's really normal. And you explained everything. And it's just so fascinating. So being able to understand that things are going to change because you grew a human and you gave birth, it's a pretty big deal. And the muscles are going to change. They're going to be different. And so it's not that we're screwed. It's not that we're going to pee our pants forever. We're going to have diastasis recti forever. It's just retraining those muscles in a way that's going to work with your new body, right?
That's exactly it. Yep, exactly it. It's kind of like I equate having a baby to being a baby, right? Like babies
Yeah.
are literally learning on a day-to-day basis how to use this body, how to strengthen these muscles. And I actually love the postpartum phase. I'm like, hey, this is a clean slate. We get to start from square one. We're going to figure out these little puzzle pieces that maybe over the last 20, 30 years have gotten a little sleepy and aren't working as much as up to their capacity. And now we get the opportunity to start from new and to start from here, build the foundation. And then all those other muscles, those big, strong muscles, those come really easy afterwards once you build that foundation.
I think that's awesome because it is a clean slate. I mean, it's a new body, and accepting that you have your babe and you have this clean slate where you can kind of build from the ground up. And it's not like you can never lift weights or do all the things that you wanted to do. And so you said some of the changes with a vaginal and some of them will be the same with a cesarean.
Mhm.
Physically, what are some of the differences comparing a vaginal birth to a cesarean birth?
Yeah, good question. With vaginal delivery, obviously you have the impact of the pelvic floor where you're going to have lengthening of the muscles. And the majority of women will have some type of tearing, right? They might have a grade one through a grade four tear or perineal tear. And those will influence recovery. So most people will have a grade one, grade two tear, which just means that the perineum, the fascia, and maybe a little bit of the muscles of the perineum will tear. And that does change some of the function of the pelvic floor because all the muscles of the pelvic floor attach into the perineum. And so that is another little caveat of why I think it's important to get some pelvic floor PT to help navigate some of the scar tissue reduction. But usually the implications of the grade one, grade two are less if you have a grade three, grade four, where you're tearing through the muscles all the way through to the anus. The research really does say that you're going to be at a higher risk of both urinary and fecal incontinence and pelvic pain and, all those kind of more negative types of things we hear about. So all the more reason to get pelvic floor PT or therapy to help resolve the scar tissue and get those muscles to heal as quickly as possible. And then versus a cesarean, although we see with like a first time cesarean that those women are less susceptible to having urinary incontinence, the numbers actually go on par to a vaginal delivery once you've had two or more cesareans. And so with the first time, what we typically see with cesareans is that when you cut through the muscle, you're actually cutting through something called our transverse fascia, which is where the abdominal muscles physically turn and combine into the pelvic floor muscles right above the pubic bone. And so they're cutting through those muscles. So they're basically disrupting part of the pelvic floor and they're disrupting part of the abdominal muscles. And so typically we might see that people who have a cesarean might feel a little bit weaker in their abdominal muscles. There's reports of higher incidences of back pain with women who've had cesareans. And it's because of this term called mechanical inhibition. It means that when we injure a muscle, that muscle will physically turn itself off to protect itself. And sometimes that's helpful and sometimes it's not helpful. In the case of having children, when we get that mechanical inhibition to these muscle groups, and it happens in the pelvic floor with tears, it happens with cesareans, it's probably not the most helpful because now we have this little baby that we're getting up 6 times a night to feed and change diapers. And so our muscles become, oftentimes we're not using them as efficiently and we're starting to develop some compensatory strategies. And so really that's why we're like, okay, for a cesarean, cesarean, you really want to start doing scar tissue work, usually around like week 4 to 6. And then there's going to be a high emphasis on getting those deep core muscles to re-engage as quickly as possible. And so that difference to the pelvic floor is that we might be taking a higher priority of looking at the pelvic floor muscles, making sure that we're doing scar tissue reduction there, and that we're starting to do either appropriate stretching or strengthening exercises for the pelvic floor faster.
Can you explain for listeners scar tissue work, what that entails and looks like at the 4-week mark?
For cesareans?
Yes.
Yes, definitely. So basically, we have quite a few layers of muscle and tissue through where they cut through for the cesarean. And so there's about 3 different muscles from the abdomen that come together to form that fascia, and then the pelvic floor muscles. And so what will happen when they cut through them is the healing process is to lay down the scar tissue. And scar tissue can kind of be like wildfire. Once it grows, it can kind of stretch out in more, all these different directions because it's trying to keep that tissue safe and secure from opening again. But then that scar tissue, once we're healed, doesn't necessarily serve a purpose because now it's going to restrict the abdominal muscles, right, from moving and contracting the way that they should. And so basically what we want women to do is to start doing cross friction massage. So I say it's like strumming a guitar string. You're going to get like 1 to 3 fingers over that scar tissue, and you're going to strum it like a guitar string, up and down, because what we're trying to do is we're trying to actually break up the scar tissue, which changes the chemical output to the brain. The brain gets a notice that something is funny down there, and it goes, oh, there's scar tissue. Why is that still there? I'm going to start sending some chemicals down there to help break it up too. And so that's why we do the scar tissue work. So I have my patients do a few times a week as tolerated. It might be that they're really sore still, so maybe they can only tolerate 2 minutes in the beginning, a few times a week. And then we might graduate up to 5 minutes a few times a week. And then you start kind of working a little bit deeper and deeper as you kind of progress. But usually around the 6 to 7 week mark, we can start putting a little deeper pressure and like kind of feel down through the different layers of the muscles.
No matter the type of birth that you have,
Mhm.
pelvic floor physical therapy is going to be beneficial, and it's going to be highly recommended. And it can even be helpful during pregnancy because then you can prepare,
Yes.
especially because there's going to be symptoms that you're probably experiencing during pregnancy, I would say for most women. And then moving into that postpartum period, being able to heal, recover,
Mhm.
whether you had a vaginal delivery or a cesarean delivery. With cesarean, you mentioned some compensation that can happen with the muscles because they're weak. What are the
Mhm.
common compensations that you will see?
Yeah, the big ones are that we will see people start using. So there's 3 main muscles in our abdomen. We have the rectus abdominis, which is our six-pack muscle, and then we have our obliques, which are these side muscles that kind of give us this side bending ability. And both of those are what we categorize as mover muscles. They're really good about moving us from point A to point B, doing a sit up, picking our purse up off of the ground. And then deep to that, we have a muscle called our transversus abdominis, which is a postural muscle. It's a stabilizing muscle that helps control intra-abdominal pressure and kind of give feedback to our whole trunk and our core system. And it's probably one of the most important muscles in our body that helps control, urinary incontinence, pelvic organ prolapse, back pain, that kind of thing, right? And so what we see is that the transversus abdominis will physically like shut off and be like have low, very electrical output after a cesarean. And what women will start to do is they will start to depend very heavily on these big mover muscles, the obliques, the rectus abdominis. And so they start to use those 2 muscles for more and more jobs. They're like allocating more funds towards those, and they start doing jobs that wasn't in their resume to begin with. And when that happens, it starts to change skeletal function. It starts to change other processes in our body because now they're not, all their resources aren't available for their job. They're spread thin. So that's why we might develop incontinence or pain or things like this, because now these muscles are like, they're doing a so-so job at 10 different jobs than a very good job at their one job, right? It's like
Right.
us as parents, as mothers.
Yeah, definitely. That makes sense. So
Yeah.
can you walk us through what an assessment and evaluation looks like for a postpartum mom. Let's say they're coming to see you around the 6 week mark.
Yes, exactly. So when they come in, if they had a vaginal birth and they feel comfortable having a vaginal assessment, some people just do not want it and aren't comfortable for whatever reasons, and that's okay too. But let's say that they're comfortable with it. We are going to do the pelvic floor assessment where it's very different than going to your gynecologist. In fact, most people, they're like, they might have an aversion to seeing their gyno and they come in and they're like, that wasn't bad at all because we don't use a speculum, we don't use stirrups, we use gloved hands and we are using one finger and we're going to palpate the tissue, meaning we're going to look to see how did the perineum heal from the delivery. And then we're going to do the vaginal assessment where we're going to assess the deeper muscles of the pelvic floor. And that's usually a palpation to see are the muscles too tight? Because believe it or not, the majority of people's muscles actually get tighter after having a baby. And it's not, it's a response to the birth where they get that big stretch. And it's called a rebound effect where they get stretched. And after the baby comes out, and the muscles like, they tighten up after. And because they're tight, they're a little bit inhibited in how well they work. Okay. So we want to know, are the muscles tight? Do we need to teach you how to stretch it, how to relax them? Or is there physical tearing that happened to the muscles? And we're usually going to show you how to work on that. And then we're going to do a strength assessment, so a Kegel basically, and we see how well does the pelvic floor lift and surround our finger, and how long can you hold it for? So we're looking at the quality of contraction. And then we're looking at where are the pelvic organs sitting in the pelvic cavity. So things have shifted during the pregnancy, and we want to see, where does the bladder sit? Where does the rectum sit? Where does the uterus sit? And look for any outliers of things that look a little unusual and might need some encouragement to heal, a little bit, more properly, basically. And so that's the basic pelvic floor exam. Then what we're going to do is we're going to come up and look at the abdomen. We want to evaluate for a diastasis recti, and we want to look at your core strength and see what your movement strategies are and start educating you as quickly as possible how to get those deep core muscles back on and start giving you some strategies to start resolving that diastasis recti. And then most pelvic floor PTs, but in our practice, we're going to look at the diaphragm and see how well the diaphragm is engaging, seeing what your breathing strategies are, because we develop different breathing strategies during the pregnancy. And a lot of women will hold on to those patterns postpartum. And we're trying to get that diaphragm back engaged to help work with our core system. And then we're going to look at your glutes and your back musculature. Basically, all the different muscles that have changed during the pregnancy process, we're going to go through and systematically look and see how are they firing and how can we educate you best to get them back on board to help you get back to exercise or get back to whatever activities you want to safely.
So it is a full in-depth assessment. So it's totally different than going to your OB because the 6 week appointment with your OB is all right, everything looks good. It's like 5 minute appointment, right? See you
Yes.
later. Call if you need anything.
Exactly. If they even look. Yeah.
Yeah.
I remember with my first child, my OB didn't even do a vaginal assessment. She wasn't going to. And I was like, wait, no, you have to. And she's like, no, it's fine. And I was like, please. So I made her look. Yeah.
That's
And she's
good.
like, you're fine. And I'm like, okay. Yeah.
That's insane to me
Yeah.
because we're not fine after 6 weeks, right? Because they're like, okay, you're clear for exercise. It's like, okay, what does that even mean? Like a walk down the street, or can I go back to CrossFit? And then
Right.
you're good to have intercourse. And it's like, well, I don't want to do that right now. Like, I don't even want to
No.
look down there. Are you kidding
Yeah,
me?
exactly. So, I would say that pelvic PTs, we're really, what I found in my career now is that like, we're the people that are there for you, oftentimes. And now there's like a greater community, which makes me super happy, of like different practitioners like yourself out there that are helping women navigate this tricky, time in their life. Like I kind of equate pregnancy, the analogy I give people for pregnancy and postpartum is that you're training to run a marathon. The training is the pregnancy and the marathon is the postpartum phase, right? Like this is the part that you're going to need to have all of your resources to help you because it's brand new, it's scary. It's like you were this functioning human prior, and all of a sudden you have a kid and you're not a functioning human anymore, right? And so it's nice to have somebody on your side that's helping you navigate these changes, that reassure you that you're going to be okay, and give you the tool sets you need to help get back to who you are and find yourself again.
I met with you before before I got pregnant because I heard you speak and I was super interested in pelvic floor physical therapy. So I went to you before I was pregnant. Of course, I went to you during my pregnancy. And then for the first year postpartum, I saw you. I can't even remember how many times. I'd have to go look, but I saw you quite a bit because, I mean, it's the first year after having a baby and
Yeah,
it's so new. And so
totally.
many things were, as you're building your strength and you're starting to go from like 3 months postpartum to body weight exercises to light weights to heavier lifting to running more high impact movements, meeting with you was super helpful because other symptoms were coming up like, whoa, like what's going on? So I think it's something that all women, all people should do, meet with a pelvic floor physical therapist, especially if you are pregnant or you're postpartum. So you
Mhm.
talked about diastasis recti and that 100% of people are going to have that at the end of their pregnancy, that ab separation. What are some things that you're doing postpartum for mamas to help them bring that back together?
So there's this PT who's spent her entire career, amazing, really famous PT that like if I met her, I'd be like, can I have your autograph? Diane Lee that has done all this research on diastasis recti. And her latest research found that 100% of women by week 36 of their pregnancy has a DRA, has a diastasis recti. As whereas before we would say, well, some people have it, some people don't, right? And we've seen this huge change in the community of how we treat this over the last decade. When I first started practicing, it was like, you will never do sit-ups again. You will never do planks again. You shouldn't run, right? And it was all these like scare factor things. And now what the research in the last like 5 years probably has really pointed out is like, no, we do need to load this tissue. We need to teach it how to move. It's a different shape, yes, but like we need to educate women how to do it. And what the research has found is that first and primarily, you need a very strong transversus abdominis. All right. That deep core muscle, the one that gets exploded with a grenade during pregnancy, is the most important muscle that will get the diastasis recti to start to come back together. And so this transverse muscle attaches on the side borders of our six-pack muscle. And so as it gets stronger, it will actually help control our intra-abdominal pressures more so that less pressure is pushing out throughout the center and it allows the muscle to lay down more flat. Okay. So that is the muscle that's going to help with like the mom pooch and changing our pressure system the most. So usually what we're doing is just, I call it neurological reeducation in the beginning. We're just helping the brain light up to find that muscle, to feel it, because most people don't even know it exists, let alone what it feels like. And then we're going to start to challenge that muscle a little bit more. So, we might start increasing as we engage our core, increase lever arms, like meaning the leg goes from just sliding on the ground and staying stable to picking up to dead bug type of exercises to challenge the transversus. When that is stronger, then we start to load the rectus abdominis, that six-pack muscle. So that's when we start maybe going, we're going to put you in a seated position. And then I want you to slowly roll your pelvis back so that you're rolling back and you feel your six-pack muscles engage. And we're looking down to make sure that they're not getting that doming or the sagging. And then they'll roll back up. So we're doing small amounts of engagement through the rectus abdominis. And then again, now we start to increase lever arms of action of going down further, right? Go back further now. We'll start adding little crunches or we'll start adding like baby planks or being on hands and knees and getting the intra-abdominal pressure to push down and the core has to engage and pull up. So really, it's all about doing these core exercises in a way that positively reinforces the muscles to kind of knit together and control our pressure systems.
If what we've been talking about today is hitting home, maybe you're dealing with leaking, incontinence, core instability, or you just don't feel like yourself after birth, I want you to know you don't have to figure it out alone. Inside the Strong, Nourished, and Energized Mom Method program, I help you reconnect with your core, support your pelvic floor, and build strength in a safe, progressive way, while also giving you the tools to fuel your body and boost your energy. It's about feeling strong, confident, and capable again in real mom life. You can learn more and sign up at wellnessbyval.com/program. So you having the brain
Hmm.
really you're involving the brain, which sometimes I think can be a little bit boring, right? When you're doing these, you're like, oh, I just want to go back to exercising, but you're having to like think about it. But the more you do that now, the easier it becomes to where then you won't have to actively think about it, right? And the time to do from when that happens will obviously be different from person to person, but neuromuscular connection. And then you're doing all the exercises, like you said, that baby is essentially doing, right?
Exactly. Same ones.
That's so
Same
cool. So when your
ones.
baby is doing floor time, tummy time, you could be doing these other exercises to be able to help with that recovery process.
Heck yeah, exactly. Yeah, and that's what I tell people. I'm like, look, these aren't gym exercises. These are thinking, these are brain exercises. And so, moms are so busy and they're so stressed that you don't, and that I tell them, I'm like, the cool thing about this is it's not going to take you a lot of time. Like, I never give my patients a million exercises. If I gave them 3 sets of 10 of every single one, they would never do them. But I give them like 1 set of 5, 1 set of 10, because I want you to be slow, intentional, thoughtful. This is for your brain. And once the brain finds that motor pathway again, it's there, it's somewhere in there. It just has to find it. Then it's going to go, oh, yeah, I remember this. And it's going to start to kick in and engage. So it's not something you're going to spend forever on. And we're going to get back to like the fun, exciting stuff. But again, I feel like it's important to change the narrative that like this is actually fun. This is exciting. This is new. This is something that like you're investing in for your future. And it won't take that much time or energy to do ultimately. And then you're going to be so surprised by how quickly the other stuff just comes along.
Exactly. I think you're right. Changing the narrative, like it can be fun when you are thinking about it, because then
Mhm.
when you're doing other things, you'll be able to like, oh, I'm not hurting my back when I'm picking up my toddler, or I'm able to actually brace appropriately, like, maybe a year down the line when I'm deadlifting or something
Mhm.
like that. And these exercises can be super helpful from probably 3 weeks postpartum to 3 years postpartum, right? And there's different
You
progressions of
got it. Like I just actually had a patient that she was coming in after her third child and she's a CrossFitter and I hadn't seen her prior, but like she had these two other pregnancies and she came in, I think she was recommended from a friend. She came in after this third baby and we did our postpartum rehab and she got back into doing, going back to CrossFit. And she told me literally that was the easiest return I have had to getting back into CrossFit. I haven't been peeing my pants. I haven't had pubic symphysis pain. Like it just came so easy comparatively to my first two pregnancies. I wish I had done this before. And I was like, yeah, because that's like when you strengthen the foundational muscles, that's just how the body is supposed to work.
exactly. How cool is that? She's like, this
Yeah,
was the easiest one. Who
yeah,
knew? I thought it
yeah,
was going to be
exactly.
like super hard and I was just going to I think a lot of moms think that peeing their pants is normal, or
Mm-hmm.
even just people, because I hear it a lot especially in the CrossFit community when people are doing double unders, like, well, it's not just because you had a baby. I pee my pants too. Well, we probably should address this, or like go see a pelvic floor physical therapist, because that's just a sign of some sort of dysfunction, right?
It is. I know. I tell people, when is it okay to pee your pants? It's okay for your baby to pee your pants, right? But it is not okay for you to pee your pants. And like joking about it, fine. I think like we can joke about it and it makes it easier to talk about it in public. That's fine. But also, like, if you had the option of not peeing your pants, wouldn't you want to take it?
Oh,
Right?
for
Like,
sure. Yeah.
I know I do. I'm like, I would love not to, I would prefer not to pee my pants in public. And so, yeah, it's just a sign of dysfunction. Really, there are so many things you can do to help decrease the incidence of urinary incontinence. And that could be, like via strengthening or even as simple as getting fit for a medical device like called a pessary. Like PTs, pelvic floor PTs, a lot of us, we fit for pessaries. So those are little like silicone rings. Essentially, they look a little bit like a diaphragm, and you insert them into the vaginal canal, and it helps like push up the bladder and push up that urethra so it secures it a little bit more. So some women who are like, we're strengthening and they're just like really still wanting to stay in their activities and they're still having incontinence, we'll fit them for a pessary while we're doing our strengthening exercises. So we're just getting that double support system. And like, so there's a lot of things out there that can really help with people's quality of life and hopefully, help them with that incontinence quite a bit, actually.
That's awesome. Yeah, because it's not fun to pee your pants and then always have to think, I'll hear older women say like I couldn't jump on the trampoline with my kids, or I don't want to jump on the trampoline or run and chase my grandkids because I'm gonna have to change my underwear. And so I think if we can address those symptoms, like if you're experiencing that at any point of time, understand that there's probably some sort of dysfunction, and meeting with someone is going to be super helpful. And then if you're in that postpartum period, other things, different things may affect it. Because I remember postpartum, I was afraid to get back into running. I was like, I
Mhm.
am scared to run. And then you're like, no, like I think you're strong enough to start running. Let's start doing this like
Great.
intermittent or little intervals, right? Like walk,
Yes.
jog, and slowly work up, progressive overload. And I was afraid I was going to pee, and I didn't, and I was so excited. But then when I started jump roping is when I was experiencing incontinence, and I was getting so frustrated. I was like, what
Mm.
is going on? So when we talked about it, you did another assessment, another evaluation, and I was able to contract really well, but my relaxation was like super slow
Mhm.
versus like contract, right? Especially for single unders or double unders where you want your
Right.
pelvic floor to, right, to contract, relax super quickly. And so
Yep.
the exercises that you gave me were so helpful. And then I integrated it even when before running, I would do these exercises, and or even before lifting when I wasn't experiencing leaking. And it
Hmm.
was just so helpful. So it's interesting how different things can impact the incontinence. And there's different types of incontinence, right?
Yes, exactly. There are actually like 4 or 5 different incontinence. We have stress incontinence, which is kind of what you are describing when we call it the jump pee, the sneeze pee, the laugh pee. So that's when the pressure in the abdomen outweighs the ability of the pelvic floor to, contract around that bladder and secure it. So then we get a little bit of leakage. We have urgency. And that's like the gotta go right now. And so, you think about the bathroom and you have to pee, or the key in the door syndrome. You get home and all of a sudden, I didn't have to pee a minute ago. And now I'm like, pee's dribbling down my legs and I can't make it fast enough to the bathroom. And then we also have like mixed incontinence, which is most people usually have a little bit of both of those. And then we have a newer diagnosis in the last like decade, and it's called sports-induced incontinence. And this is specific to somebody's sport. So, for example, like I had an ultra marathoner come in and she was fine. She could run 18 miles fine, but the second she would get to 18 miles, like every time she would start peeing her pants, right? And so for her, she could do everything, jump on trampolines, but it was like once she got to 18 miles, she was having incontinence. And so it's just specific to that athlete's sport. And then there's functional incontinence, which is like you maybe have a broken leg and you can't make it to the bathroom in time, that type of thing. And so, really with incontinence, if it's a stress incontinence issue, that means that structurally something is not working together within the core musculature to control the intra-abdominal pressure. And so we need to probably start to strengthen, or we need to balance the muscles. So for in your case, the muscles were kind of tighter. They like to hold on to the contraction. They didn't like to let it go. And so you were working with a shortened system that you were putting high repetitive loads through. And it was like taking it through like a taut trampoline. It wasn't doing its job, right? So you needed some education on how to lengthen the pelvic floor so that it was at its full length and super receptive to be able to contract, support that like increased weight, and then relax and get ready for that next jump, right? And so that's why it's really nice to have, the internal perspective of doing a pelvic floor exam to be like, yes, these muscles are tight, let's lengthen them, or these muscles are certainly very weak, let's start to strategically strengthen them for your sporting activity or whatever's happening with you.
The sport one's interesting. So is that just those muscles were getting fatigued at a certain point because
Yep.
the repetitive motion? Okay.
Definitely. It was an endurance issue for her. So what we did for her was I would say, all right, when we would schedule her appointments, I would say, hey, can you actually, before you see me, I want you to run like 18 miles. I want your pelvic floor fatigued. I want to see what we're working with, right? So she would go on a run for 18, 20 miles, come in, and then we would check the pelvic floor and see what was going on with the pelvic floor. And for her, it was like I had my baseline measurements and she was actually kind of like strong, but then when she came in after 18, 20-mile run, we checked and that pelvic floor was so fatigued. So we started doing our sport specific training was like every time we would do it after she would do her run, we were starting to do our specific training in that fatigue level for her to start improving her endurance. And so it really like made a huge difference for her.
That's so cool.
Yeah, it's super fun, right?
Yeah,
It's like
definitely.
being a PT, you're just like playing detective and every case is a different story. So it's really fun and exciting.
So
Yeah.
that's why an internal evaluation probably will be good because it's not like, oh, you're having incontinence, go do X, Y, and Z. It really
Yeah.
kind of depends on when you're having it, why you're having it, what are the muscles doing or not
Uh,
doing, if they're weak, if they're tight. So that can be
yeah.
super supportive for it. Okay.
That's right. Just don't go. I like tell people, I'm like, don't do stupid Kegels. Don't do stupid Kegels because like you don't know. Like,
Exactly.
like they're not necessarily for you. And I've been a pelvic floor PT for almost 15 years now, and I'm like, most people need lengthening before they need strengthening. So yeah, it's really important to have an assessment and kind of like segueing back to the pregnancy postpartum, like advocation. Like, even if you went in for one appointment at like your week 35 pregnancy to get a baseline to help give you education on the birthing process and came in for one appointment at 6 weeks post, it's going to be like life altering for you. It's going to be so helpful, just to get you on the right track, basically. So that's like my biggest pet peeve. I'm like, please go see a pelvic floor therapist, even if it's once or twice, it'll make a huge difference.
A huge difference. A huge
Mhm.
difference. And yeah, I tell people that all the time. And when I saw you before I got pregnant, I didn't realize it, but I was basically contracting, Kegling 24/7.
Mhm. Yeah.
So like for me to just go do Kegels, that'd be stupid, right? That wouldn't make
Right.
any sense because I was like, oh my gosh, I'm doing the dishes and I'm like
Isn't
contracting
that
and engaging.
weird?
Like, what am I doing? I need to
Yes.
relax and lengthen. And it was so difficult to do, but it was very helpful working with you and understanding that because then I was able to practice those things to make birth a little bit easier, right? To make recovery a little bit easier. So I totally
Exactly.
appreciate that.
Yeah, no, exactly. Well, I know. I'm so glad that you came in and I wish everybody would kind of like, proactively do that or that our doctors and OB-GYNs would proactively send their patients, even like I said, for one session because man, to be able to imagine having a really tight pelvic floor and then pushing a baby out, you're going to increase your incidences of trauma, of tearing with a really tight pelvic floor. If you learn how to breathe and relax and lengthen, it's really going to help the delivery process. So like it makes a huge difference for people.
For sure.
Mhm.
Now, let's shift gears a little bit to pelvic organ prolapse. You mentioned it a little bit earlier, and I think that can be hearing those words can be a little bit scary for a lot of women, myself included. But can you explain what it is and why we don't have to fear it? Why don't we don't have to be scared of it?
So pelvic organ prolapse, essentially we have three main pelvic organs. We have our bladder, our uterus, and our rectum. And they have ligaments that attach it to our skeletal frame, right? The ligaments are there to keep them in place, and keep them kind of, snuggled up, right? And structured or into our structures. And so basically what happens with pelvic organ prolapse is that those ligaments lengthen. That can be from the delivery process of us pushing or bearing down. It could be from a history of constipation. We see it with people who have congested heart failure and are coughing a lot. And it can be, basically what happens is those ligaments, as they lengthen, the pelvic organs will push down into the pelvic cavity. So women will report saying, oh, it feels like there's a bulge in my vagina, or I'm sitting on a ping pong ball, or it feels like pressure. Sometimes it can cause incontinence, or it can make it difficult to void, or it can cause constipation because it just shifts where those organs are normally sitting. And we stage it from a stage 1 to a stage 4 in severity. And we used to say the numbers used to be about 35% of women had pelvic organ prolapse. But as a pelvic floor PT and, talking with all my other colleagues and everything, we'd be like, gosh, doesn't it seem like everybody has pelvic organ prolapse, that the organs just sit a little lower, or, there's a lot of variation? And I would just remember having discussions with other clinicians, and we'd all be like, yes, totally. In the last few years, what we have found is that the research actually indicates that upwards of 65% of women have pelvic organ prolapse. So the organs are sitting, a little bit lower in that pelvic cavity. And what the community at large is wanting to do is maybe change the definition of prolapse and saying, hey, maybe it's more normal than we think it is. And maybe it's actually not a bad thing, right? That it's like we used to be like really scared and like, oh, you need surgery, and going, hey, actually, there's probably a lot more variability to where organs sit in our pelvis than we thought. Some sit lower, some sit higher, and that's okay. But if it's causing, issues or symptoms, then we really want to start strengthening and controlling your intra-abdominal pressure systems, because essentially what it is, it's like a hernia. But the hernia is in the vaginal canal, all right? And the organs are pushing the muscles down lower. And so we can really work on doing core strengthening like you would with stress incontinence to help absorb loads better. We can teach constipation and pooping strategy, so we're not bearing down. And also a lot of it for women postpartum, some of that prolapse is coming from scar tissue at the perineum, the muscles adheres down inferior to the prolapse, to the organs, and that's pulling the muscles down and pulling those organs lower. So for some people, the easiest solution is just doing scar tissue work, and that will allow the organs to kind of pop back up. But for most, we're doing a combination of that and strengthening.
Okay. Thanks for
Like,
explaining that.
yeah, it's
That's super
not the
helpful.
end of the world,
No.
it's like, lots of women have it. I have it after having my children, and I'm doing heavy weightlifting and it's fine. It's like lots of people think they can't run or lift weights. You're going to be okay. You just need to, get those deep core structures back on, basically.
Okay. So just like with doming, coning, leaking, or any other types of symptoms, it's kind of just like a knock on the door or notification saying, "Hey, let's pay attention to this and do some exercises or relaxation techniques or whatever it is to be able to help with it."
That's exactly it. Yep. Those symptoms are telling you that just something's not, working cohesively together. That's all
How
it
does
is.
it how does it change as we get older, as women get older into the perimenopause and like especially postmenopausal when we lose estrogen? Does that have an impact on the pelvic floor?
A really good question. 100%. So our sex hormones, they're basically like the plumper upper hormones of our pelvic floor. So they plump up a lot of oxygen, blood supply into the muscles and make it nice and cushiony. And as we lose those hormones, the muscles actually start to thin out and have less support structure. And so it's kind of like blowing up a tire with air when we're like young and have a lot of hormones. That tire is full of air, and as we lose the hormones, the air starts to sink out, so there's less support. Interestingly enough, this also is the same with our postpartum women, because we go through, basically we're in menopause the first 3 to 4 months postpartum. We aren't producing sex hormones, and so we also can suffer from what's called vaginal atrophy. Yep. And so, like, usually, like, a lot of times women will come in postpartum and say, oh my God, my vagina's falling out. And I'm like, wait, wait, wait. There's a lot of things, a lot of strikes against you right now. Like, you just had a baby, the muscles are turned off, you don't have any hormones, right? Like, there's all these things that are making things feel heavier. And, the good news is it's only going to keep getting better every single day, right? With strengthening, with the return of your hormones and all of that.
Interesting. So when for women who, and I know this is like a totally different topic, but I'm super
Mhm.
interested for women who are in that postmenopause space,
Hmm.
Would and experiencing those, of course, the exercises and everything that you teach your clients would be super helpful, and we'd want to do that because as we age, we want to keep exercising and challenging all our muscles. Would
Hmm.
estrogen, would it be topical estrogen?
Vaginal estrogen, topical
Vaginal
estrogen,
estrogen?
exactly.
Okay.
Yes, 100%. We, really advocate for that for women who are having vaginal estrogen or vaginal atrophy, because it's not systemically absorbed. It doesn't affect the breast milk. It doesn't, baby's not going to ingest it. It's literally only absorbed locally into the vaginal tissue. So it's basically giving it that plumpness. And so a lot of women who are breastfeeding and they have inhibition for extended periods of time, 6 to 12 to 18, 20, 24 months, they'll get vaginal atrophy and pelvic pain, and the vaginal estrogen can make a really big difference. And if they're really against using, the estrogen, then there are other things out there, like you can use hyaluronic acid. Good Clean Love has a nice vaginal moisturizer that can kind of help plump up the tissue too. So there's other options that can give you more of that like hormonal contribution too.
It's
Totally.
pretty
Yeah.
awesome.
I know I could do another whole podcast with you on our sex hormones and how it affects.
Yeah, that's awesome. Maybe we should
Yeah,
do that.
totally. Yeah, absolutely.
So
Yeah.
for mamas breastfeeding, they may experience mastitis.
Mhm.
Like that was something that I was afraid of when I was breastfeeding because I overproduced.
Yes.
And I remember you told me like after I think it was before I had my baby girl, you said, "Hey, if you feel like you're experiencing mastitis or feel like it's coming on,
Yes.
call me, let me know because we can help you with that." And so
Yep.
because I was overproducing lots of milk, I started feeling like I was getting sick once and like it was like very tender and warm to the touch.
Mhm.
So I called you, I went over to you. It was one of your other providers who helped me with that. And I thought it was super amazing. But can you please explain and talk to us about how you can help moms with mastitis and first of all, what that is, how you can help, and what are some alternatives compared to antibiotics?
Yeah, definitely. Again, so mastitis is basically where you have inflammation in the milk ducts, and then that causes some of the bacteria to kind of spread out within the breast tissue and create an inflammatory event, an infection, right? And so it just gets trapped in there, basically. And so it used to be like, massage it, put heat on it, get antibiotics. And again, in the last few years, the research has like drastically changed. Like, please don't put these mamas on antibiotics and change their biome, baby biome. Um, really, we want to treat it like it's an inflammatory issue. So we want to ice it. You can use NSAIDs, but from a PT standpoint, what we do is something called therapeutic ultrasound, which is a device that puts these like radio waves through the breast tissue that cause the tissue to expand and contract very quickly. And what it does is it allows the inflammatory markers to move out, and it promotes anti-inflammatory markers. So, and then we'll do lymph massage as well after that to push the fluid through and to push that like infected if there's infected liquid through, but it allows basically less inflammation and better flow of the milk after. And like our clinic, if someone calls us with mastitis or breastfeeding issues, we get them in with 24 hours and have a very high success rate of avoiding antibiotics. But even so, most mastitis type of things nowadays, like the up-to-date literature is saying, try not to give them antibiotics, see if they can work through it first. And so that's what we do. Like pelvic floor PTs will help you work through it, decrease the discomfort, get things moving, move that infection through faster. And so I wish that was something that that mamas knew instead of just like jumping on antibiotics right away.
Definitely, because if you didn't tell me about that, then I would be like, oh my gosh, now I have to go like call my
Mhm.
doctor and get antibiotics. Like,
Yep,
and it's
exactly.
painful. Like, you don't want to even like go there. So I'm super grateful that you told me about that service and it helped tremendously. And that was the
Good.
only time
Yeah,
that I experienced that. Like, and it
yeah.
helped instantly. And I didn't use heat, I used cold, like you said, and it was super helpful. So thanks for explaining that because I think that can be something that moms, if they are starting to get those types of symptoms,
Yes,
it can be more of something that's preventive because we don't want to take antibiotics. We don't want to disrupt, yeah, like you said, our microbiome, baby's microbiome, especially you're breastfeeding. And then what if you have to get on antibiotics again? Like that's just a lot.
exactly. Exactly.
Okay,
Yeah.
cool. So if you could wave a magic wand
Mhm.
and make sure that every postpartum mom knew one thing about her pelvic floor, what would it be?
Oh man, my magic wand here. Okay. If what you said postpartum?
Yes.
Oh, okay. Yeah. So if a postpartum, I would say, that it takes time and it takes a little bit of energy for it to heal. So don't expect overnight for it to be better. Like really give yourself that 4 to 6 months. Be patient with yourself before you like start with higher level activities, right? Like don't expect it to be back to normal right away, but that it will get there. It just takes a little bit of time and patience and maybe a little bit of work as well. And so I think that's ultimately what we talked about this whole time is just like education is power. And that if you have any of those issues like incontinence, pain with intercourse, anything like that, there's help out there. Like, and don't be afraid to get it.
I love that advice. Thank you. So take
Yes.
things slowly,
Yep,
patient, and then don't be afraid to get any help.
you got it.
Awesome. Thanks,
Exactly.
Genevieve. Where can listeners find you and what is the best way to connect with you or work with you, whether it's virtually or in New Mexico?
Right. So our website is www.methodptnm.com. So like PT New Mexico. And you can reach us through there. And we're always happy to do telehealth or meet in person. And we also have our Instagram page which is Method PTNM. And so you can reach out either way if you want to talk to us. But we're really open and receptive. We love community outreach. We love like chatting with prospective patients on the phone just to see what's going on and kind of get to know you a little bit better. But that would be the best way is to reach out through our website.
Awesome. And I'll put all of that information in the show notes. So if you're
Great.
listening and you want to connect with Genevieve and her clinic, you can do that. So thank you again, Genevieve, so much for being on the podcast. I'm so happy to have you and I'm very grateful.
Thank you. And thanks so much for what you're doing for the community too.
If you're ready to take what you've learned today and put it into action, join me inside the Strong, Nourish, and Energized Mom Method. We'll walk through how to rebuild your core and pelvic floor from the inside out, fuel your body without restrictive diets, and create sustainable habits that actually fit your life as a mom. You can get all the details, grab your spot, and the exclusive bonuses at wellnessbyval.com/program. And I will be there to coach and support you every step of the way. I know that you're probably walking away from this conversation feeling informed, empowered, and ready to take the next step in your healing. If you're listening and resonated with what we talked about today, make sure to check out the links in the show notes to connect with Genevieve and learn more about pelvic floor physical therapy. And if you've enjoyed this episode, please take a minute to subscribe to the podcast, leave a quick review, and share it with a mom friend who needs this information. Until next time, stay strong and nourished. I'll see you next week. Hey mama, I hope you loved today's episode. If it resonated with you, would you please take 30 seconds to share it with another mom, a mom who's looking to make healthy eating and exercise easier? Because we need that. And if you haven't yet, I would be so grateful if you could leave a quick review on Apple Podcasts. It truly means the world to me and helps the show reach more amazing moms like you. All right. Time to chase my toddler around, stay strong and nourished, and I will be back on Monday with another episode. Talk soon.